Did he not give you one?
No. Was I supposed to have that?
Yes, sure. I'm sorry.
No. You put one over here?
I'm so sorry. Here you are.
All right, thank you.
Okay, we're going to get started with the 13th meeting. The Commission on Fatherhood and Boards will now come in session. My name is George Garrow. I'm the chair of the commission. I want to thank you for coming out tonight. A few of our commissioners are missing, but we're going to have a roll call from my left to right.
Tamara Henry.
Yeah, speak out loud, please.
Good evening. My name is Tamara Henry.
Good evening, Elsie Scott.
We want to thank both of our new commissioners. This is their first meeting, so we want to welcome them as well. I'll acknowledge Tony Dever, our executive director, who will talk about, provide a brief introduction on the work of the history of Commission on Fatherhood and Boys.
Thank you, Mr. Chair. The Commission on Fatherhood and Boys was established by the D.C. City Council in 2013 for the purpose of addressing disparities in education, economic opportunity, fatherlessness, health and well-being, issues of public safety, and the rehabilitation and reintegration of returned citizens in the District of Columbia.
One of the areas of responsibility is fatherhood. Tonight, that's what we're going to talk about. We're going to talk about several fatherhood programs in the city with a focus on the DC Collaborative's work, which is the longest running fatherhood program in the city. I'll introduce again Tony to introduce the speakers for tonight.
Yeah. If I can, Mr. Chair,
Sure.
to put context to the presentation coming up, we'd like to provide for the Commission a few program updates.
Sure. Please do.
So, commissioners can find in their various folders 3 one-pagers, actually outlines that pertain to our 3 fundamental initiatives in 2018. One initiative that's been around for a minute is the Books and Barbershops initiative. And of course, the Books and Barbershops initiative is designed to raise awareness on the value of academic mentoring, specifically in the area of early childhood literacy. As the Commission is very aware, probably many people in the community, we've been able to set this program up in about 35 barbershops. Just this month, a few weeks ago, we did a Black History Month event on the history and value of barbershops in the African American community. And I say that to say that what that did for us is kind of reintroduce the program, some volunteership, as well as greater involvement and donations for our barbershop program, Books and Barbershop. So we have a new donation coming in of about 1,000 books. That will be our second major donation from Junior League. What's also beautiful with this is we have now a few barbershops, only about 3 or 4, that are looking at building out space specifically for the program. This is a kind of really good movement because what happens is our new partner that has been involved in the program for a while, the DC Public Library, they have an expanded outreach team by which they will be going into barbershops and conducting reading workshops. They will do outreach outside various barbershops to promote some of their reading programs. So that's an update on that. Our new initiative, the County DC Dash initiative, is something that's been in the making for a minute as we engage our interagency groups. We have finally crystallized how we want to go about taking a program that connects services that's already occurring within our agencies and ensure that dads are getting the social supports that they need. And so we're working currently with Project Empowerment to identify fathers in that program.
Okay.
and then connect them over to Department of Human Services where they are doing fatherhood, or I should say responsible fatherhood training. That training is called 24/7 dads. So what's very good about that is the incentive base that will exist as a result of the Project Empowerment program where they're actually subsidizing the experience. What we want to try to work out is one day out of the week they will be able to leave their job and go to groups.
Okay. Now, is that is it including the participants in the empowerment program?
Yes.
All the participants?
All of the fathers.
Okay.
We want to specifically target and identify the dads, and then to make that opportunity available for them. That would be a part of their subsidized employment experience. So we want something that's not going to be taxing on that experience, like maybe an hour and a half, where they can actually agreement be worked out with their employer, and they can go over to the groups, and they can get the responsible fatherhood training. And then from that, we could also sponsor some additional activities outside of the job, where they may have father-child playtime and those kinds of things. So what happens here is we just get to capture the fathers, get to connect these services from one agency to the next, that otherwise up to this point had not been connected. So it's a great idea. I talked to the Department of Human Services today, and the administrators running that program are very excited about it. Their recruitment efforts have been a little challenge. They've been looking at creative ways to try to get dads in the program. I say, hey, how about we get some dads from Project Empowerment and try to, work that agreement out and then get them over, for those experiences. As you very well know, Project Empowerment serves really a lot of our at-risk fathers or fathers who may be in crisis, coming home from prison, in various situations of that type. So this kind of additional services, I think, will go a long way and be much needed for their stabilization.
Okay.
The third program is our Promise Initiative program, which is a program for our DC Public School males. It is a professional development program designed to facilitate and cultivate career experiences for DCPS youth who are nearing high school graduation. And this program will complement their current academic experience with career-based field trips, mentoring and hands-on professional development workshops. And primarily what we want to emphasize with this program, again, is the career-based field trips where they will actually connect with African-American professional males and the work that they're doing. But I think even more so is that being kind of, the highlight of the program. We want to provide other services for their grooming and their professional development around shoe care, how to coordinate dressing accessories and grooming things, and skincare, and those kinds of things. We want to bring in a host of our partners who specialize in that work. I think DCPS has a shoe repair program, so there's a guy who's really, really knowledgeable on how to take care of shoes, dress shoes, and those kinds of things. Needless to say, I don't think I probably need to elaborate on the fact that that will probably be a benefit, I think, to our young men, probably very so.
How many young men do you think would be involved?
Well, we want to, this is slated to start in the fall. We have approached Ron Brown College Preparatory School, which is our all-male high school, and Dr. Williams is very interested in it. Of course, we asked him what did he need out of it, because they can make it work for him. And of course, he asked that the partners would bring to the table, the business partners, that they provide one brand new suit for each male child participating in the program. And so, our partners, right now, we are approaching various businesses, various highlighting this particular initiative, coming in the fall. And of course, we do have an action that hub here in the city. This meeting with them today, they're very interested in this program. So I just wanted to provide those program updates in terms of what we are doing generally this year in 2018.
Fantastic. Great. So, as we move into, we're going to have 2 presentations tonight.
Yes.
The first, DC Collaboratives.
Yes.
Why don't you introduce them?
Yeah, so, Mr. Sheriff Dean, we come up to the table, and Mr. Jackson Williams. These 2 gentlemen at the table here, these 2 gentlemen are from the Fatherhood Educational Empowerment Program that ran in the District of Columbia probably about 8 years. Mr. Ibrahim was the citywide director for the program. Probably, as you very well know, they are currently 5 collaboratives across the city. And so this program is very comprehensive in providing services in all areas of the District of Columbia, from Adams, Oregon, over east of the river towards 7th. The program had fundamentally 4 components to it. There was a case management component, there was an employment component, and then there was a responsible fatherhood training component. So let me, and I'm sorry, a healthy relationship. The healthy relationship component. The reason why I was a little hesitant with this particular program is to precursor to the current fatherhood federal program that is happening now that has added the behavioral health component. Of course, that carries a host of questions, but nonetheless, that is added now to these programs. Mr. Sheriff Dean Ibrahim will speak to some of the outcomes, some of the information that he has, data that is reflecting various areas of that program. And then Mr. Williams, Shafter Williams, who has worked very closely with various fatherhood curriculums, will talk about the impact of those curriculums. What I will say right before I turn it over to them, but the success that I've seen over a number of years now just disclose that we all have worked at different points over the years in serving this population. One of the great impacts of this program is the curriculum. When you actually look at what transforms fathers, what create some long-lasting stability in families, the manner in which fathers come into the program and exit the program has been through curriculum-based training, when it makes a tremendous amount of where we know greatest benefits in terms of how families are stabilized. So I'm going to give you both Mr. Ibrahim and Mr. Williams.
Yeah, so that's the only mic we have.
Let me say, if I can, this microphone does not work. We have to project. We record our meetings, our meeting minutes, and so this microphone is recorded. And we put it on our website if you want to go back and hear it.
Good afternoon, everyone.
Good afternoon.
My name is Jasper Williams, and I serve as the senior support staff for case manager for the PEAK program, which was in operation for at least about 8 years in the District of Columbia.
No, go ahead. Go ahead.
PEAK was a federal funding program, new cutting edge, aimed at promoting responsible fatherhood in the District of Columbia. What we do, we provide direct and support services to the fathers by helping fathers become employed, improve their employment status, and increase their financial support to their families. We help the fathers gain a better understanding and the important role in co-parenting or parenting, and taught classes. One of the curriculums that we were teaching at that point was quenching the father's thirst. And then healthy relationship with this. Of course, you all know Ms. Lisa Muhammad. She would come in and she would talk about the importance of co-parenting. And it's not just a B program, but it's a we program as far as the parenting relationship is concerned.
Did you have fathers across the collaborative?
Fathers across
In
the
all
collaborative.
5 collaboratives?
All 5 collaboratives. The program was called the FEED program.
Feed.
Right. Fatherhood, empowerment, educational program. And then third, we have the economic stability, where assets built, job readiness, job searching, job coaching, taught resume writing, we taught how to tie ties and how to go on interviews, coach interviews. And we had a barber that would come in and give haircuts. And a couple of churches donated shirts and ties, and those resources to the farmers. We provided transportation in the form of tokens, bus fare for job interviews. And then, we would monitor and make sure even when they got the job, we would do job coaching, where we would talk about the job, what's going on with the job, what are some of the burdens of the job that you need to overcome. A lot of it was transportation. A lot of jobs were out in Virginia and they get up early in the morning. And we provided, we provided alarm clocks for them to get up. A lot of the fathers, even the job, readiness program, we did resume writing. A lot of fathers, we found out, didn't have email addresses. So we provided email addresses. And those are some of the barriers that some of the fathers had. And a lot of the fathers did not have driver's license or proper ID or didn't have their birth certificate and Social Security card. These are some of the burdens they had. And one of the things we also worked with the core committee on child and family services, and they had that program called Connecting Dads. At that point, before that, fathers were not being connected. When those files came out, the files were always in the mother's name. And so I was in a core committee where we formed a program, and it was called Connecting Dads. And even with the social workers, they had to connect the dads as well as, could the mom come down? They would have to do that because if they didn't, it was in their evaluation. So it's insensitive for them to go ahead and reach out to the father of the child as well, because we found out there are also more resources for the father's end of the family as well as it is on the mother's end of the family.
Now, I know most of the funding from the collaboratives comes from Child and Family Services, right? So what role did they play, if any, in the program?
With the Fatherhood Initiative?
Yeah,
Child and Family
speak up so
Services?
everyone can hear you.
Were you referring to Child and Family Services?
Yes.
And the funding? I'm sorry, good evening. Thank you for
Good
having
evening.
us, panel, and commissioners and commissionerettes, if that's a word. The Fatherhood Initiative was an Administration for Children and Families fully funded initiative. So this Child and Family Services Agency did not
Play a role.
play a role.
Okay. Sure.
As far as the curriculum is concerned, one of the curriculum that we taught was Quenching the Father's Thirst. The other one, I'm a master's trainer, Dr. Jeff Johnson initiated, and it talks about fathers, for unwed fathers, for young youth men and those. Let me start by saying this, that when you're dealing with urban city kids, this is a different situation than a rural area. I think you guys understand that. It's a different monster, if I might say that's a word. All right? They had a lot of barriers that they have to overcome, just living in an urban city. Okay? And so a lot of research went into this curriculum. Dr. Johnson, I think, started initially writing this curriculum in 1990. So there are years of experience, and it has been remodified, edited, because we know that it progresses. Our knowledge progresses about this
Did you do any recruiting from DC Corrections and returning
Yes, we
citizens?
did. Yes, we did. We Mr. Kevin Lineberg.
I'm sorry.
Kevin Lineberger. He's I think RSC. I think that we 19th from Mass Avenue, right? We entry program. We would go down and we would meet these returning citizens, that are returning within the next 5 to 6 months. Introduce the program to them, make a connection, so that when they do come home, they know where these resources are, know where we are. So, and that's one of the things that we did in that. Then it was a life skill. Just teaching young men just life skill. Just one of the things we talk is no man is an island. Know exactly what in your neighborhood, what resources are in your neighborhood, and what do they do? A lot of people didn't know that maybe employment had a satellite place in their neighborhood. A lot of people didn't know, a lot of things. And so, no man is an island. It's good to be resourceful and know what's in your community and take advantage of it. Because a lot of guys don't know how to navigate through systems. They don't know how to navigate. They run from it. Child support. They run from it. And get deeper and deeper in the problem when we tell them to embrace it. You be the first to go down and say, I'm going to provide child support. Okay.
Did you have involvement with DC government child support?
Yeah, Judge Milton Lee.
Attorney General?
Yeah, Judge Milton Lee.
Judge Lee.
He does a child support court down there. We were in partnership with him. Some things have been changed.
Yeah.
And during the course of years that if you come down and report that you've been incarcerated, those years will not add up while you're incarcerated. And then also they had a program there where they had an economic stability. They would help find jobs for fathers too, so they wouldn't go underground. Okay, and make it a bigger issue than that. And then the other one was responsible fatherhood. Just be responsible. You're an added commodity. You take a child to school. You go to PTA meetings. You go to the doctor. You go to the dentist. You help with homework. If you don't have a job, okay, then you add some of these other things. You say, okay, I might not be working right now, but I'm gonna be the babysitter that'll cost you. At least you want to take the child to daycare because your child is staying with me. Being an added service. So teaching them these things.
Has there been any discussion in the collaboratives of finding a way to replace the funds the federal funds that were lost to run the program?
Yes, sir. So the FEED initiative ended in fiscal year 2015. Since then, each individual collaborative has kind of taken its own.
Speak up, sorry, everybody can hear you.
I'm sorry. The FEED initiative ended in 2015, fiscal year 2015. And at the end of the grant cycle, the collaboratives individually and collectively have identified alternatives to continue to support fathers and men in the community who are looking to get connected to services and programs. Currently, we don't operate as a FEED initiative because each collaborative kind of internally works to provide those services with the additional funding that we get from our continuum of services menu, basically. So,
and that's what I meant when I was talking about child and family services.
Yes.
I know that the collaborative for their other work
yes,
receives funding from CFSA.
that is correct.
And I was wondering if CFSA has made any commitment for dedicated funds toward fatherhood work.
We have not received monetary or fiscal contribution to carry on this work. This work is being done as our family-centered practice. Okay. As we recognize men are in the homes and are part of the family, so we tie that into our full scope of work with families in general. Okay. I would just like to speak to some of the performance and how the program model really operated citywide. So in wards 1, 2, and 3, fathers were served by our collaborative partner, Collaborative Solutions for Communities, who used to be formerly Columbia Heights Family Support Collaborative. For Ward 7, fathers were connected to the East River Family Strengthening Collaborative. For Wards 5 and 6, we had Edgewood Brooklyn Family Support Collaborative working with fathers. In Ward 8, we had the Far Southeast Family Strengthening Collaborative. And in Ward 3 and 4, we had the Georgia Avenue Family Support Collaborative. So that's how we were able to cover the city in its full spectrum. Also, the deliverable and the performance measures of the grant required the collaboratives to serve over 300 men annually. So that is from starting fiscal year October 1 to September 30th. And we broke that out to each collaborative having 50 to 60 fathers that they will work with to provide case management supports to. In addition to that, those fathers were connected to those ancillary supports that the program offered, be it parenting workshops, be it healthy relationship workshops, be it job readiness and job placement efforts. We did some creative job training. I believe we did some certifications for fathers, forklift training, Mr. Duggar. You were able to make that connection. We also had some additional vocational certifications of fathers were connected to from our network from the community at large. So some of them had HVAC training certifications, some that had green cleaning certifications. So we were able to utilize those dollars to, in a sense, make the fathers gainfully employed, knowing the climate that they were going to be walking into, coming home as returning citizens and things of that nature.
Were you able to tie in UDC Community College?
Yes, so UDC Community College offered trainings that fathers had the opportunity to take advantage of that were free. Unfortunately, I cannot speak to us having great success with that because fathers in our programs had a few challenges. One was transportation, getting to and from. So one of the reasons why the collaborative model works and one of the reasons why the collaborative model is successful is we are in those specific communities. We are right there. Fathers don't have to go from one end of the city all the way to the other side of town to get connected to services. So when you have the services right in their communities, we're able to bring them in right there so that they can identify what their needs are better. So we wanted and we tried to build on those partnerships that we could citywide, but we also ran into some challenges because of the logistics to operate some of those partnerships. We knew presented challenges. Many of the fathers worked during the day, so we had to build our program sometimes on the evening time for those that were available in the evenings. Those that were not working during the day obviously could come in during the day and do some of the job readiness, some of the job training initiatives that we have available to them.
Did each collaborative have responsibility to bring in 50 to 60 men?
Yes, sir.
Yes.
So the expectation, I'm sorry, yes.
To the chairman's point, I was going to say regarding
Speak up so the audience can hear you guys.
to the chairman's point regarding performance, you have an estimate of how many fathers came through the program?
Absolutely. So annually we served we exceeded the performance standard of serving 300 fathers. With that being said, that was a combination of job placement. That was a combination of putting at least 200 fathers in parenting classes. That was also another 50 fathers get connected to healthy relationship workshops with the consultant. So our performances annually exceeded the performance standards of the grant, which allowed us the opportunity and afforded the collaboratives 2 additional years to operate the grant after it initially had ended. Those outputs really helped to drive the need to continue to work as long as we were able to under the Administration for Children and Families funding. Any other questions you had, sir? Something Mr. Williams and Mr. Duggar also shared that I think is important is many of the fathers that we work with were custodial fathers. So we were dealing with fathers that had an active role, or we were trying to reconnect to have an active role in the lives of their kids.
Sure.
Some of the challenges we had was we have fathers that did not have custodial involvement, but wanted to also participate. So we were able to also bring them in and tackle some of the issues and some of the barriers that they were having, be it in the relationship that they had with the child's mother, or be it financial contributions and supports that they could make. And we were working with them to actually gain custodial rights through this grant. So many fathers that initially did not have custodial involvement, by the end of this program, when they were done with the collaborative practitioners, were able to have joint custody or full custody of their children.
But what types of things were you able to do to get a buy-in from the significant other, either the wife or mother of the
child's
child
mother?
of the fathers that were involved in the program?
I always think that it's important that anytime we talk about fatherhood or the fatherhood movement, we always keep in mind that in the forefront, this is still family-centered practice. So fatherhood is just a component of it. We still are talking about how to serve the family, how to meet the needs of the family.
Yeah.
And one of the things that our Fatherhood Feed initiative really did a good job was we had a component called Family Group Conferencing, which is a solution-focused model where we invited the family, the father's spouse, significant other, ex, or whomever you want to call it. We invited them to the table, so they were fully involved from the onset about the work that the practitioners were going to undertake with the men in the program. So that consisted of the father, who they identified as partners or whomever their relationships were. We had also the family practitioners involved in those family group conferences, and we also had the employment specialists who worked with the practitioners to concentrate on identifying employment opportunities and employment supports for the men. So those employment specialists really concentrated on making connections and linkages in the community about certification opportunities, job placement opportunities, workshop opportunities, dress for success opportunities. So those family group conference that we had really made it an inclusive process. And the women got to understand what the efforts and what the work that we were trying to do really looked like, and they were not in the dark or put aside while we did this work. They were actively involved. And many of them, and this was a voluntary program. I'm sorry, I should have stated that from the beginning. This was 100% voluntary. So every father, every man that we touched, every family that we work with came in voluntarily. There wasn't a court requirement. There wasn't any obligation for them to do the program. So we thought that was impactful in itself because they were looking for the need and the supports that we could provide for them at that time. I think I also wanted to talk about some of the activities you guys did with the families, right? You guys.
We provided 2 activities a month with the families, whether it be going to a Wizard game, the Globetrotters, the Ice Capades, the circus, the Nets games, the zoo, two activities a month where the entire family go and, we take pictures and the father engage with their children and the mother of their children, create memorable moments, and we found out that was the drawing piece or the reconnecting piece to the co-parenting piece, when they could actually see, the father doing the things he's supposed to do, like trying to find a job and going to his meetings or going to the classes and really engage in the process of becoming the best dad that he possibly can. So those activities that we did, along with, like I said, the haircuts and going to the children's schools. We had activities at the schools where we had moon bounce and face paintings, and father would engage with father and child basketball games, father and child prayer breakfast, and all these kind of activities that would involve.
I think it's important since I see practitioners who do this work way more than I do and have more knowledge about this than I ever did before I came aboard. I think it's important to acknowledge the fact that fathers and men in general have or continue to have trauma and some other issues that get into the way of their parenting abilities. And I think one of the things that we wanted to always do was really create a safe space and a safe setting for men to come together and just have an opportunity to just talk and express their feelings without judgment and really know that they're not alone. They're not the only ones experiencing some of these challenges that they were encountering. So I think even creating that avenue or creating that environment for them where they could have those intense, sometimes, challenging conversations amongst one another, I really think that really was therapeutic for them in a lot of aspects because they were able to see that there was a light at the end, right? They were able to see progression. They were able to see that it is possible to be a contributor in the lives of their families, in the lives of their children, in the lives of their partners. And I think that a lot of times is kind of not highlighted enough, that just creating a space and creating a forum where men can come together and we can talk, we can address some fundamental and core issues that we need supports on, really goes a long way to how they parent and how they can effectively parent their children and be supporting, loving husbands and partners and spouses.
Were you able to assess yearly how many children were actually included in all of the with all of the fathers that were involved in the program?
Yes, sir. There's two parts to that. Do we have that data? Yes, we have that data. All of the program participants, they had to go through an intake process, an enrollment process. We were able to capture the household demographic information, that financial information, a lot of supporting components to really highlight why this is a very much needed support to the men. Unfortunately, because the grant ended before we anticipated, the research piece about our data collected was not completed. So we still have that data. We are hoping with our partnership, whether with Kids Count or another research entity, to one day get to that point where we can really look at the data we've collected, because we have over 10 to 15 years of data working with
You were not
men.
able to complete your evaluation.
Yes, sir.
That's what you meant.
That's correct. But we have data was and is available for us to do an evaluation on.
Yes, sure. As a matter of fact, I think it would be a good time to open it up to commissioners and also the audience.
Yeah.
Sure.
So, and you may not have this, I just like to ask the question if I can, sure, and work on that. Do we have anything that shows a period of stabilization in the fatherhood piece after the program? Was there any ability to kind of follow or try to monitor? And if not, then I know we had some anecdotal pieces. I know we had some young fathers who really connected, that really got it, and they kind of carried over, what they got out of the program. If we do not have anything comprehensive at the time when you or the collaborators take the data that you had and complete it, would that be something that you think the organization would consider, tracking some of these dads and seeing where they are now?
I think that that's part of the evaluation piece that will be required to kind of see the full impact, and more importantly, to see if we did make that shift, and that paradigm, the pendulum swinging the other way for the men. Obviously, we know from firsthand experience working with the fathers that while they were working with the collaborative practitioners, while they were connected to those programs and those services and those supports, they thrived, right? However, the opportunity to do the follow-up, whether it's 6 months later, 12 months later, that's part of that evaluation that the commissioner will have to also consider. Because I can clearly tell you that we have many fathers now who come back and who are asking for supports that unfortunately we don't have the menu of services that we had previously under the grant to provide them. What we try to do is look for alternatives that can address some of their needs currently, based on what is available at the collaborative. and as well as citywide, all right?
Go and finish your question.
Yeah, I was just going to go follow. So, and I may be jumping ahead. I know that you're starting up a fatherhood service imminently. Exact date, not sure. So, with what you just stated about fathers returning, looking for a menu of services, how would you meet those needs with what you're doing now? Just give a little description on what you're trying, what the families are trying to do.
Great question. That's spot on. So when we talked about what we are currently doing to address this gap, we are not as the collaboratives, and I'm here representing the 5 collaboratives because I work with all the collaboratives. What the collaboratives have made a priority at this present time is really reinstituting that parenting, quenching father's thirst, relationship with their child-parent interaction, really putting that back as a priority in our programming, because we know that the employment piece and the job training piece and the workforce piece, that's something that requires funding to really make comprehensive. So what we are doing is utilizing our parenting programs and our parenting supports through partnerships with child and family service agencies to really highlight fatherhood involvement, parenting involvement, relationship, parent-child interaction. And that's really what all the collaboratives have really now, some are already ahead of others, some are just revamping this, but that is where we really want to start, is to really put them back in a space where they can come together, they can convene, they can have cafes, they can have that dialogue, and they can have that safe space to really just get things off their chest and ask and identify how they could get support through their peers. So that's what we are collectively all doing across the city, is really getting that parenting, that child interaction piece that is father-focused, father-centered, back up and running across the city. And then we will try to put all those other pieces that our FEED initiative made available to them around job readiness, workforce, healthy relationships with their partners and everybody, and all those other components, slowly plug them back in as we are able to meet those deliverables.
Commissioner Scott?
Yes. You mentioned that you were not able to do the evaluation because the grant ran out.
Yes, ma'am.
What was the original, who was going to do the evaluation? Was it going to be outside evaluators or internal?
Yes, so in order to be awarded the grant, we had to have an evaluation done initially. And that evaluation was done with Child Trends. That was the entity that we used that strengthened our efforts to win the grant initially. So we were coming back to that step where Child Trends was going to look at the data that was collected over that 6-7 year period to give us a status on the impact the work had done. So that's when unfortunately, we lost that opportunity. But Child Trends was our partner at that time that did the initial evaluation and was going to do the follow-up evaluation.
Have they considered contacting some of the universities to see if maybe there's a student who might be interested in doing a doctoral dissertation?
So when we started the discussion about the evaluation, the follow-up evaluation, we actually had established an MOU with the University of Maryland. They were going to use some of their graduate students, and that faculty was going to kind of put something together for us to use to offset the opportunity if Child Trends was not available. So we were going to use a combination of either University of Maryland or Child Trends. We identified Child Trends as a more suitable partner because they have done the initial evaluation, so they could do the comparison a lot cleaner, a lot easier. They understood our data collection efforts and everything else. But that's kind of where we were. We had explored and we had reached out to our community higher education institutions.
I just wanted to add on to what Commissioner Scott said. I'm a professor at the George Washington University Milken Institute School of Public Health.
Okay.
We have a practicum program, which I'm the director of. We'd be happy to lend you some students. They have to do 120 hours each, and I'm on the health promotion track. So we do have people available that would be interested in this data and part of their program is to analyze secondary data analyses. So that is available.
We kindly welcome and thank you for that opportunity.
You just made a connection.
Exactly.
And I also wanted to just follow up on what the behavioral health components were of your program. You spoke about a lot of different entities in terms of responsible fatherhood, case management, employment, but what specifically did you do around behavioral health?
Great question. So we recognize that the men, not all the men were ready to participate in the program. And as I initially stated, the collaborative model in itself is a family-centered practice. However, we had practitioners who were focused on the FEED initiative, which was the father component. When we ran into those challenges, because at intake, when we sit down and we go through their history and we see where some of the barriers, some of the challenges are, the model and the approach that we took with the work was to have our FEED practitioners reach out to their contemporaries within their collaborative to make sure that we were also addressing some of those gaps through the case management component of the work. So, for example, Mr. Williams, as a FEED practitioner, had access to a Department of Behavioral Health coordinator to help us navigate their system when we ran into some of those challenges. But a lot of that information really came from what we gathered at intake when we sat down with them and how we prioritized what we needed to address first, even before putting them into any of these programs, because many of the men required another step before we actually started working with them and connecting them to job readiness, parenting, relationship programs. One thing that we did, one thing that I'm proud of, when I got involved with the FEED initiative that Mr. Doug and this group didn't have initially, was the opportunity every year to add another component to our program. So every year we grew and we added pieces to it. By the 4th year, we had a consultant that did a transformational thinking, 2-week, highly intensive, 4-day week, half-a-day workshop with the men. And that became really important because that was the orientation. That was kind of like the gateway into our FEED program. And that really just was more about those guys sitting down, coming together 4 days a week, and really going through many components of them, of their inner selves and their well-being to really determine, is this something that they're ready to do? Are they committed to this for the longevity, for the long term? And I think that transformational thinking workshop, if you guys recall, I think it really helped. It really gave those guys that extra boost, that extra incentive, that affirmation, that encouragement that they can do this. This is not something that is overwhelming, or this is something that they are alone in doing. So the last 2 years of the initiative, we introduced that transformational thinking piece as the orientation to our FEED initiative for every father that was interested in taking it. For fathers that were not available, that were not interested in taking it, they didn't have to. But those that wanted to take it, it was available for every father to participate in.
Commissioner Hugh?
I have a follow-up question. So I'm a licensed psychologist by training, so I was encouraged to hear your discussion about trauma and what your counterpart said about some of the dialogue that you've had about who you are. And I was wondering if some of those conversations centered around who they were as Black men and what that means in our current society and current political climate. There's a lot of research around how Black fathers have conversations with their sons about what that means and things that they do to sort of counteract some of the racism and oppression, and how that can be protective for youth hearing stories from their father and just discussing about what it means to be a Black man. So I was wondering if that was a part of the curriculum. And then also, it sounds like there are a lot of really great components, and I'm wondering, is it based in any theory or sort of what is the model? Because there are lots of great research around sort of African-centered, Black-centered psychology, and I'm wondering what you all draw upon to develop the different parts of the curriculum.
Now, just to note, President Obama was president at the time at this program ended.
Yeah, that's correct.
funding for the federal funding for that program in.
And pretty much when it began.
Yeah, and that's absolutely when it began too as well.
Yes, we did. One of the things that we had guest speakers. We have forums. They come in and talk about what it is to be a black father. I remember one of the forums, what it is to be a black father in an urban city. Okay, and that's really a different dynamic. Of course, you know. And also, why do I need an education? What's the importance of me really attending school? Because you know, a lot of Washington, a lot of trade schools are no longer in existence no more. You know, like electrician, learn how to mechanic. I think the only one is Phelps. I think it's Phelps. We had it in all the high schools, and so now they're forced. A lot of kids don't want to go to college. A lot of kids they can't see themselves in college, you know. And so a lot of these like shoemaking and all these other, you know. So what we did was we partnered with UDC Workforce, right? And
we really need to talk more about that in the city. For those of you who are not aware of it, not to interrupt you, I just wanted to make that point that UDC Community College folks made a presentation in front of the commission several months ago. It was one of the a forum in front of the commission, and they talked about these various programs and workforce development programs that are tied into working collaboratively with DOES, Department of Employment Services. And what many citizens are not aware of is that if you come with a GED or you've graduated a high school diploma, many of those community college those short programs, 10, 12 weeks, 14 weeks or so, are free. If you make a commitment to come to the program, participate in the program. So you're talking about, and I believe HVAC program would be included in that, right? Yes. And so these are, and you get a certificate or a license, a CDL program, commercial driver's license.
We have a lot of construction companies and things that, you know, that understand that these people are graduating with electrician 1, electrician 2 licenses.
Yes. And that might be a $5,000 program if you had to go out on the street and buy that.
You know? Your truck license, you know, all of that. So, yeah.
Can I respond to your question at the end real quick? So you were asking about the theory and the models. So I'm going to be very careful in what I say and how I say it, but I'm going to say it anyway. And I don't think you really answered your question, so I'm going to try to answer your question. And I'm going to do it in a way that it doesn't get either one of us in trouble. So the Administration for Children and Families is a federal Department of Human Service agency. Therefore, all of our curriculums, all of our programs that we offer have to operate with a level of cultural sensitivity, diversity, right? And I think regardless of demographics and needs and wants in certain communities that we know are prevalent and disturbing, we know that our program is for the entire city, Washington, D.C. Therefore, we have to cater and make sure that we can meet the needs of our Latino communities, our African-American communities, our Amharic communities. I mean, D.C. is a melting pot. So we have to be very thoughtful about what curriculum we thought could best meet that threshold across the spectrum. And I look in the room and I see a practitioner, Dr. Bruce Purnell, who I believe talks about those things, about making sure that curriculums and theories and models that we take really are focused on the audience and the communities that we work and we operate out of. But we have to be very strategic in how we use certain curriculums, because we wanted to make sure we stay within the guidelines of the grant and did not violate any terms of the grant and the conditions of the grant. Does that make any sense?
But you did use Dr. Johnson's
Our
curriculum
practitioner,
for the most part. Right?
our fatherhood, our practitioners went through Dr. Johnson's curriculum so that they can know how to engage fathers.
Yeah. Okay.
But the curriculum that we use to work with the fathers in the grant, the Quenching Father Thirst curriculum itself is a National Center for Fathering curriculum. Okay. Does that make sense? Yeah. So Dr. Johnson's curriculum was to give them the tools and the support they needed to be able to engage and work with men of color and those things. However, when we were outreaching and building the capacity of our program, the curriculum that we used to build that parent-child relationship interaction was the Quenching Father Thirst curriculum.
We have another panel to begin, so we want to thank you for making your presentation tonight. And Tony, you can introduce the second panel participants.
Yes. So again, thank you to the collaboratives and their representation concerning the FEED program. Our second panel tonight is from the Department of Health and Mr. Devin Anderson, who is the Public Health Advisor, would do a presentation on the Department of Health Parents with Kids 2 years and Younger program, focusing on healthy starts. Within this program, they have a fatherhood component. And so Mr. Anderson is going to talk about that program, and he's going to give us some tidbits around some of the health disparities that exist for fathers and across the city from one ward to the next. Thank you.
Welcome, Mr. Anderson. Sure. Now you've got to speak up because that is not a broadcasting mic; it's a recording mic.
Yes, sir. Yes, sir. Thank you to the commission for having me here. My name is again Devin Anderson. I'm with the DC Department of Health, Family Health Bureau. I work with the DC Healthy Start program.
Okay.
And we help our citizens in the district, our parents with children 2 years or younger. We have a partnership with 3 agencies: Murray Center, the Community of Hope, and Children's Hospital. We're working with them to get out into the community and reach our men and women. They also bridge our program to 5 years of age. We normally go for 2, but they go for 5 years of age.
Each of the partners?
Yes. Yes, sir. And I just wanted to come here and just give a brief presentation on what we're working on. Right now, we have a partnership with the Department of Corrections and the Department of Employment Services. We are working with them to implement the Inside Out program starting in mid-March. We will be going and talking with the men in the prison from the Project Empowerment program inside the prison. It's a transitional program, work development program. From there, they will be going into the Department of Employment Services. But we are working with them to provide case management services. We have heard a lot that when the clients come out of the
So do you start an identification of placing people in the program? Do you start from the child? In other words, child and work toward the parents, or
No,
I mean, exactly how does that work?
We start from prenatal on.
Okay, but what I'm saying is, you're identifying. You've got a mother who's had a child in one of these, one of your partner institutions, right?
Yes.
Okay, all right. And then you reach out from there to the parents and to the fathers.
Right. Yes.
All right. Okay.
All right. And besides that, we're also working on a couple of programs. Like I said, the housing program. I believe giving the men a safe environment, and working with DC Public Library to have more men engaged in the STAR program, the Sing, Talk, and Read program. There's been a lack of fathers at these events. There's more mothers and caregivers at these events than fathers. So we're trying to come up with a special events going on starting in April that we're going to start doing Sing, Talk, and Read for dads. And that's to really help out with one of our goals, to have a safe environment, and especially with co-parenting groups that maybe there will be like a lack of, when we're dealing with co-parenting, we don't want it to be a downgrade when we go to dad's house. As far as safety, as far as education, we don't want it to be a downgrade. We see that a lot of fathers who are not living in the house do have roommates or certain conditions that may not be helpful for the child.
Well, is there? I mean, the program is a coordinated program among the partners,
Yes.
right? And so, does each partner identify potential families be a part of the program?
Yes.
I mean, you just noted earlier that you went to identify, that you played a role in identifying. Yeah. I was really just wanting you to talk a bit about how most of the participants are identified and brought into the program.
Okay. Most are identified really through. I think each program has different approaches. We normally go through the Department of Employment Services and DOC, but there are other ways, including the New Heights Parenting program that they also go through, and from referrals straight from Children's Hospital also.
I see. Okay. All right. You can continue.
Yes, and just coming up with some of the other plans for the program is our fatherhood environmental scan, and the fatherhood environmental scan, we're talking with fatherhood groups in the city, and we're trying to get data for specifically for men and fathers. I don't know if you noticed, but if you go and you look for data on fathers, there's not a lot of data built up. We're trying to get as much data as we can so we can make some changes.
You mean data on fathers throughout the District of Columbia?
Throughout the District of Columbia, yes, sir.
Okay.
And mostly in wards 5 through 8. Does anybody have any questions?
Any questions? As a matter of fact, why don't we open it up so that we can be certain that we get
just wanna
audience
follow up on
discussion.
that
Oh, I'm
data.
sorry. You go ahead, Paul.
Specifically,
Commissioner
what
Scott.
kind of data are you looking for on fathers?
Specifically, it's a host of different data, but we're also trying to figure out the right questions to ask. We've been doing some of these services for over 3 years. We've been going in the jails and Department of Employment Services and things for years. But we're just coming up with surveys to give to the clients, and we're trying to come up with some of the correct questions to come up with that. We're definitely looking at housing. Are they a part of a family? Is it a single family? We're looking on health disparities. We noticed that in the last DC Department of Health report, we're around 90% of our men and women have health coverage, but we want to know if they're using the health coverage. A lot of times we see it at 91%, but we still say, when's the last time that you've been to the doctor? When's the last time that you had a prostate exam? And that's still like around 46%, I believe. So those numbers don't really match. So just having services is really not enough. We have to make sure that they're doing what's done.
My name is Kirk Allen. I'm the Public Health Advisor for the Department of Health, and I also work with Devin. To add more to the data component, we wanted to know what data is available in DC, and we can provide, especially the health component updates, especially for chronic disease. We work closely with the chronic disease department. And so seeing what data is out there and providing the most recent data, we can compare areas that need other improvements, provide guidance to organizations who want to do health screenings for fathers, so providing that data.
I saw other questions. Sure, go ahead. Speak up so we can hear you.
My name is Nana Bakutu. I'm an instructor at Georgetown University. I actually work in public health, but I'm curious if you're looking at mental health of the fathers, and also their sort of health literacy in general, with how they interact with or support their children's health and their own health as well. So those are sort of two data points.
Great question. For the mental health, another opportunity we want to work with is called collective impact. So I'm leading the collective impact group. So collective impact is just like a structured form of collaboration where the group comes together with cross-sector leaders. Right now, one of our partners is the Department of Behavioral Health. And so through our goal of improving birth outcomes in the district, we would create a working group just for the fathers. And so the Fatherhood Working Group can include our Department of Behavioral Health partners, and then they can decide as a group, and also contributions from community members with lived experience to focus on areas that are relevant. That's up to the group to decide, and that's an opportunity for us to look into. It's an innovative space for partners to work together who haven't worked together in the past. It's just a way for the Department of Health to network. If you need to talk to somebody for another example, a partner is a CFSA. If you want to CFSA. If you want to talk about partnerships, potential funding, we can provide that network and for you. So collective impact is just a different way to create systems change. So we're not creating new programs, just addressing any gaps in the system.
Back here.
Yes. You said the STAR program.
Identify yourself, please. Identify.
Your name?
Oh, my name is Clinton Curry from the Climate Solutions in Columbia Heights. The STAR program, can you explain that a little more what it stands for? And I caught the end of it, you said fatherhood environment for it.
SCAN. I'm sorry.
SCAN.
So STAR program.
Yes, the STAR program is Sing, Talk, and Read. Sing, Talk, and Read program is with DC Library. They normally do classes during the day, which is often a problem for the father sometimes, but they just recently started doing more around the 6 o'clock, 7 o'clock hour and weekends. What they do is they encourage parents to sing, talk, and read with their children. I know somebody asked a question about literacy, and
Did that answer your question? Wasn't there another program you referenced? The STAR program, but also
I didn't know what you said about the fatherhood program or
SCAME. Okay.
Oh, I'm sorry. Okay. So, and as far as the fatherhood environmental scan, we'll be going to different agencies and collecting data on. Oh, okay. Yes.
You can continue. Go ahead.
I would also like to add another reason why we're presenting tonight is also to convey that the Department of Health is here to provide support. Meaning different health components that partners or organizations would like to talk about. So if it's data support, we can explore that option.
The DC Department of Health
Yes,
has provided that in the past, data support?
No, so that's what we would like to look into.
Oh, yeah. I was wondering. I'm just.
So that's another thing with collective impact is building relationships that haven't been done before.
Okay.
Providing best practices for having healthy relationships with fathers and members of the family. So exploring ways, and we're very open to partnerships as well.
Sure.
Devin, I think you mentioned that you do some work with DOES around project empowerment. I work in DC Corrections when I'm not at GW. And the clients that I have, specifically in the RSAT program, which is the Residential Substance Abuse Treatment Program, this is my 4th year working there. I work both on the men and women's unit doing HIV and substance abuse education. And what we find is upon entry, 90% of the men are diagnosed with comorbidities. So nobody knows they have a mental health challenge or issue until they're in the correction system. So they've stopped going to school by 6th grade. They've dropped out. The majority of the guys that I work with, they start to self-medicate very early. And now, for the first time, they're 19 and they're being treated for their bipolar schizophrenia. And it's like they feel 1,000 times better, but had not known this until they got to jail and, had a formal intake. That's problematic on a number of levels because when they get out, you mentioned the homelessness issue, which is what we talk about a lot. Not being able to transition effectively, and if you have no place to stay, how do you have an address to get a job, and you have no health insurance? So just the Medicaid piece or something to help them at least address their mental health issues so that when they go to the 3-week program at Project Empowerment, they can keep a job because they're able to take their medication. But what we find, because I've been there over the last 4 years, is that they keep coming back. So here it is, you go through 16 weeks of the program with me, and I hope to never see you again. And I always tell them that, and then I see them again because of lack of housing and back to self-medication and violating probation. So they're back in the jail. So it seems like almost a safe space for them, for lack of a better term. So I'm wondering how DC Department of Health and perhaps behavioral health, along with the OES, can really do something to address that. Because if they don't have health insurance, even though you suggested that 90% is very high, but these inmates don't seem to be connecting to care so that they're recycling and coming back through the system.
That's a good question. There's a lot of components to that piece. And one way we were trying to address that and other areas with health since we're focusing on infant health. This is our team. When you talk about infants, you're talking about mothers and fathers in the community. And so with that, we decided that collective impact is an outlet. It's an innovative space for partners to work together who are interested in making systems change. And so with that, DOH is not telling the group what to do. The group decides what to do. And DOH guides the process of collective impact of creating a common agenda, having everyone agree to collect data in the same manner and track and measure progress, having continuous communication and reinforcing activities. So not creating new programs, but leveraging what each does best and aligning activities. And so that the mental health component is something that's been brought up during my key informant interviews. And so that's something that when we have our next meeting that Department of Behavioral Health can probably address and look to the group and guidance on what areas they should focus on.
Another question? Yes.
Aligned with that question, listening to all the presentations, I'm curious what the commission, like how the commission looks at sustainability and what the, I think the previous presenters also talked about returning individuals and sort of this continued
Sure.
Support, and what is sort of the underlying thinking around sustainability, or how do we make these programs so that they are building that in from the beginning, and you don't have 8 years where people are coming back and needing that support.
Now, when you speak to sustainability, you're talking sustainability of the program itself, or the fathers being able to reach a plateau or a point in time when they are not able and not have to return through the program and reset, have a reset.
I'm speaking on both fronts. So I think the previous panel talked about funding ending and
Yes.
having effective evaluations
Right.
and sort of programming, and so the sustainability of the programs themselves, and sort of what, I guess, new business development or fundraising, grant making approaches.
Yeah.
And then also for the sustainability of the impact. So a lot of great anecdotal evidence around these fathers and their stories, their life trajectories. How do we keep that going and not have that sort of?
No, I got you. I mean, that's the $64,000 question. I've run a program in the district, a nonprofit in the district, and we received federal funding, and we ran a program that was a corollary to the Fatherhood program that was funded from the same Administration Children Families federal fund, the Department of Health and Human Services, as the Collaboratives program. But one of the challenges I think we have in the district is, you see, most of those programs, when you're talking about these fatherhood programs, those are broad-based programs. You're not going to fund those programs with $25,000. Those are, generally speaking, hundreds of thousands of dollars. You're talking about a number of fathers and families. And so from a sustainability standpoint, you have to have large funders to weigh into that field. So once you have, the federal government is a large funder, but in the District of Columbia, one of the challenges we have is we don't have a lot of national funders who are co-funding those types of programs. And that's one of the things that we'd like to find a way to encourage here in the commission, being able to attract national funders to high-functioning programs where there's a multi-year, generally, again, hundreds of thousands or millions of dollars, multi-level, multi-year funding of programs. And so the real challenge is that if you don't have the federal government involved with those types of programs, generally fatherhood programs, mentoring programs, large-scale youth programs, if you don't have that, it's difficult to sustain those programs over more than a year or so.
Yeah. This is my ignorance. I work a lot in the international sector, so I don't quite know all the funding mechanisms that you use. But is that, like, when you say national?
Yeah, I'm talking about, when I say national, I meant foundation, national foundation funding. Yeah. So again, when you're talking about those programs, the federal government, if the federal government is funding programs, generally speaking, they're funding programs that are national, that have implications nationally, even if they're funding locally. And they're funding for funding programs that have that include many participants, a large number of participants, and therefore they're willing to fund at a high amount. Most of the foundation funding that we have in the district is small level funding. And at best, what you're able to do is to get a large grant, like the type that collaboratives have, and then string together maybe some small foundations funding on a smaller level. But again, you still have the problem, a dilemma that if you lose that large funder, that program is going to lose its independence. I mean, that's the reality. So that's one of the challenges one of the things that we're trying to weigh in on and trying to find ways to assist those that are doing that type of work, and trying to find ways to work with the current DC administration to make the city a more attractive place to attract that type of funding. And so what you really have to be able to do, at least in part, is to show collaboration across agencies. That's one of the things that we've championed with the commission. And Tony, Mr. Doug has done a great job of helping to put together the intergeneration, interagency program, and to talk about each other's program. This is why we have a DOH here, for example, a DOH here, for example. But doing that is an important part of showing national funders, large foundations, that we have the type of collaboration, federal government, smaller foundations, private nonprofits, that we are establishing or promoting the type of climate where a large funder could come in, fund a project, and see results. The other half of it is what we were talking about with respect to the collaboratives, being able to show an evaluation, a promising evaluation. So, yes, sir.
What I've seen, I've dealt with customers with the mental health, can't find a job, the low unemployment. When programs end because of funding, it's always because of what's the next program, what's the next program, what's the next program. So a lot of these residents who I've talked to, they've been going to programs, so many programs, they're like, okay, what's next, what's next, what's next. So like you said, if we could just find one straight funding from all these different agencies, maybe they can stick with one thing and move forward. And also make a choice, because if I can't make a choice, I'm always keep going to the same cycle, the same cycle, the same cycle. So I have one set of customers I deal with. It's okay, I'm going to make a change, whether it's a program or not a program, and then make a change and build a family. But you have the other side where it's always like, okay, what's next? Which one give me now? Which one give me now? Kind of thing.
Well, one of the things that is important, the more successful programs, when they bring their participants in, they try to orient the participants to not see this as, well, this is a program. And when you finish this program, you go to another program. Generally speaking, what you want to do is to be able to orient people to understand that they're on a journey. The program is helping them on that journey. And hopefully, at the end of that program, you're seeking to achieve something. So with the fatherhood programs, the most successful fatherhood programs, you build in an employment piece, you build in some metrics where you're talking about, you're trying to show that the family is functioning at a better level. And most importantly, you're talking about how the participants themselves will sustain what they gained in the program. To get them to appreciate that the program may have helped them and facilitated the progress, but it is they themselves that made it happen, and it's they themselves that are going to sustain this after the program.
I mean, that transformational thinking piece that they spoke about earlier was really,
Yeah.
The
Yeah,
empowerment
absolutely. That's important. Mm-hmm. Any other questions? So I'll give you 5 minutes to wrap up. You don't need 5? Well, for those who would like to learn more, could you provide some contact information, your names again, and contact information?
Sure. Kirk Allen, Public Health Advisor.
I didn't hear the last name.
Allen.
Allen?
Yes.
Okay.
Tony has both of our emails.
Okay. All right. Kirk, first name? Yes. Okay. Mr. Allen
And Devin Anderson, Public Health Advisor.
Fantastic. We want to thank both of you for coming tonight. We really appreciate it. While we're at it, could we have the commissioners who came in late to identify themselves?
Jelani Moraine.
Okay, thank you. One thing we wanted to do also is, unfortunately, we have a member of our family leaving after will be his last commission meeting. Adrian Brown is a program analyst who has been with the Commission of Father, Men, and Boys since its inception. I understand, I just heard tonight that Adrian is moving on. He has another job that someone else has decided to steal his talents from us. But we wish you well. We want to thank you for what you've done with the commission. It won't be forgotten. These first 2 years have been challenging for us, and without your steady guidance, along with Tony, we wouldn't be at the point we are now. So we want to thank you and wish you well for the future. I'm sorry?
If I can add.
Oh, yeah, you can most definitely add.
Look, the Commission on Fathers, Men, and Boys. Mr. Brown will be a father probably in a matter of weeks.
Oh, really? Oh, congratulations.
New responsibility.
Yeah, right. Well, we wish you well. Congratulations. Any other business we have to conduct before we adjourn? We have a question here. What branch or division do you work with? OJP? Okay. Sure.
I get a bird's eye view of some of the grants that come in. Unfortunately, with this new administration, we don't have any grants that we had last year.
Yeah.
But last year, we were able to secure 2 grants in our community. So I am looking to have a connection for when these grants come out. They come out, we're behind because we're going through reductions and things like that. But they come out in March.
Mm-hmm.
It's imperative that we have some of these programs apply to these grants.
Sure.
I must have gave out like maybe 80 grants last time. I only got like 5 jobs. So if you all can connect me with somebody, I would be more than happy to see what's available and also send you away.
Yes, Tony would be that connection. We most definitely would want to learn more and to share that with other programs, other community. Any other questions, announcements before we adjourn? Entertain a motion to adjourn.
So move.
Second? All in favor? All opposed? Thank you very much. Meeting's adjourned. You don't expect to get it again, right?